So Pennsylvania recently updated its plan to fight opioid addiction. Um, can you outline some of the new highlights, and are there things that you'd like to see in
Sure.
future of that?
So again, our governor, Governor Wolf, is committed to addressing the opioid crisis. And really from the beginning, it has been all hands on deck. It has been all different agencies working together. And another point emphasized by the governor is collaboration. And so we are really working together as state agencies and collaborating. So we are working now under a disaster declaration. A year ago, the governor declared a disaster declaration for the opioid crisis in Pennsylvania. The way that works is that they last 90 days, and so that has been renewed 5 times now. So we're in the 5th iteration of 90-day disaster declarations. And that has brought now 17 different agencies together to our opioid command center, our opioid operational command center at the Pennsylvania Emergency Management Association. And we meet every week with many phone calls in between to work on our collective response. There are 3 pillars to our response. The first is prevention, the second is rescue, and the third is treatment. So we have many robust prevention efforts to help prevent people from becoming addicted to these very powerful medications and drugs. And so some of our prevention efforts are with the schools, with youth, some prevention efforts with the public, and then the efforts that I have been focusing on are working with the medical community to learn to prescribe opioid pain medications more carefully and judiciously. And the term I like to use for that is opioid stewardship. Opioid stewardship. So opioids are actually very necessary medicines, essential medicines in medical practice. And if you're at a local hospital now and you fractured your leg in a car accident, you would need an opioid. If you had a major operation an hour ago, you need an opioid because we don't want people to suffer from acute pain. We have patients with chronic pain, such as cancer pain, end-of-life care, palliative care, that need opioids. And so we do not want people to suffer. However, one of the factors that has led to this opioid crisis has been the previous overprescription and overuse of these very powerful medications. So we have efforts to work with the medical community to learn to use these medicines more carefully and judiciously. Thus the term opioid stewardship. Our next pillar or category are rescue efforts, and that involves the medication naloxone, sometimes known as Narcan. Naloxone is not a new medicine. It's been used in hospitals for decades, but this community use of naloxone is new. And so, as Physician General in 2015, I signed 2 standing order prescriptions for naloxone. One was for first responders to have naloxone, and the other is actually for the public to have access to this life-saving medication. And so I signed a prescription for the state that anyone in Pennsylvania could go to any pharmacy and obtain naloxone either as a nasal spray or an auto-injector, which kind of looks like an EpiPen. And so first responders, such as basic life support, such as fire departments and police, have saved well over 12,000 lives in the last number of years with access to this medication, naloxone. And then the public has had access through pharmacies. Last month, we had Naloxone Day, where we distributed over 6,100 kits of this medication free to the public. And we plan to follow up with some people who actually ran out. And so we're following up with 1,000 or more patients to get them the naloxone that they need for their families. And then we hope to repeat that later this year. And so we want to save people's lives. I reject completely the idea that anyone's life, everyone's life is worth saving, whether they suffer from the disease of addiction or not. So the idea that someone suffering from opioid use disorder or heroin addiction is not worth saving, I reject that completely. Everybody's life is worth saving. Everybody deserves a chance at life and recovery. And if they've overdosed several times, then this is the time to save them, and there's always a chance to get them into treatment. Now, I do understand, however, that naloxone is absolutely necessary, but it's not sufficient. We have to get people into treatment. And so that goes to our third pillar. And the first part of that is a warm handoff, a facilitated referral to treatment for instance, from the emergency department. So several years ago, with our other sister departments, we developed a warm handoff clinical pathway for emergency departments to use to work with the county drug and alcohol authorities to get people into treatment. Last year, we had a series of 6 summits to roll that out, and we're going to have 8 summits this year, this spring, to further perfect that system. And we have counties getting 50%, 2/3 or more of patients who might come to the emergency room after overdose into treatment, to life-saving substance use disorder treatment. So a warm handoff. And then we've expanded treatment in the Wolf administration. And so the state of the art for most patients with opioid use disorder is to have medication-assisted treatment. And that's with medications such as methadone, buprenorphine, otherwise known, one brand is known as Suboxone, or long-acting naltrexone, and the brand of that is Vivitrol. They all work differently, have different indications. And we support evidence-based quality medication-assisted treatment. Now, that doesn't mean seeing the patient, writing a prescription, and saying, have a nice day, I'll see you in a month. That means getting the patient into therapy and counseling, as well as case management to make sure that they stay there and other aspects of their life are progressing as well. And so through the Department of Human Services, the governor started 45 centers of excellence for patients predominantly with Medicaid throughout the state. And then through the Department of Health and other agencies, we've started a program called PAC-MAT. That's not Pac-Man, that's a different thing. PAC-MAT, Pennsylvania, PA, Coordinated Medication-Assisted Treatment. This is a hub and spokes model to try to expand access to medication-assisted treatment throughout urban, suburban, and rural Pennsylvania. There are 8 PAC-MAT programs supported with federal funding to be able to expand access, again, throughout Pennsylvania. So those are our different efforts. We have a very robust data dashboard available on the governor's open platform website where you can look at different data. We have a website for the public as well. And so we want to get the word out about all of the different efforts as well as treatment options. We have a new program where people can go online and find different treatment options depending upon their insurance as well. So we really want to expand access to all forms of treatment for opioid use disorder and other substance use disorders as well. We're making progress. I absolutely think that we're making progress, but we're not stopping now, and we're staying laser focused on working through and solving the opioid crisis in Pennsylvania.